It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are helping to change people's lives.
This is the place to come to find the doctor just right for you, and we'll start it off with our first doctor, that is plastic surgeon, Dr. Robert Wilcox.
One of the misconceptions about plastic surgery is that everybody comes in as a model, wannabe, and so forth, but that's not the case at all. There are all different needs of people who come in through the door.
Last year I had a mammogram, and I have had 2 cysts in my right breast for a couple of years and was concerned. My mother had passed away from breast cancer. My family physician, she suggested that I come see Dr. Wilcox. I talked to Dr. Wilcox about a breast reduction, and at the same time when I came for my consultation, I talked to him about a tummy tuck.
She had had significant weight loss, but she recognized she was still heavy. She was very large-breasted as a result of that and wanted breast reduction, as well as recontouring her abdomen. She was considering having a tummy tuck, but her dimensions after we examined her weren't conducive to a safe outcome doing a tummy tuck. So what we were able to offer her instead was simply removal of the lower hanging skin and fat of her abdomen.
It's something that I'd wanted done for several years, but didn't really know if it's something that would be feasible for me. But after talking with him, and he gave me all the information about it and told me how good it would look afterwards, and that's when I decided that I would go ahead with the procedure. I've been very pleased with Dr. Wilcox. His information, his bedside manner, he's very informative. He takes all of the time that you feel like you would want, and any questions that I've had, he's taken the time to draw me pictures and to answer my questions. And his nursing staff and the recovery room, I've never seen anything like it. The nursing staff were so caring, and I never had a fear of anything, of taking infection or anything, because they were so caring and so attentive to my needs.
Listening to the patient, understanding what they think they're going to get, and reassuring them what we can and can't deliver, then we can achieve those goals. Everybody's happy.
I'd been having a lot of pain, mostly in my left shoulder and in my left back area for about a year. More and more, it was where I couldn't lift my left arm, and then I just started feeling some numbness and tingling in my arm.
Denise came to see us because she was having severe pain starting in her neck and traveling all the way down her left arm with some numbness and tingling and actually weakness, and it's been going on for quite some time. And she actually sought us out for minimally invasive options and options beyond the more traditional spine surgeries.
I went for about 8 weeks of physical therapy, and the pain kept getting worse. I did go see Dr. Musacchio. I did a lot of research on him about his outcomes and the minimally invasive technique that he did, and so after a lot of research, he was my top choice to go to for this procedure.
We did get an MRI, and her MRI showed that she indeed had herniated a disc and was pinching a nerve in her neck, and that was causing this pain and dysfunction in her arm. It was very troublesome for her. A good surgical option that we offered her was a posterior cervical foraminotomy from a minimally invasive approach. And what that means is from the back of the neck, we could go in with a very small incision and a small set of tubes to preserve the muscles and to limit the amount of tissue disruption to actually get to the spine, and unpinch the nerve by removing disc tissue and small bone spurs that were pinching the nerve.
I love to ride horses, and that is one of my biggest passions. And it had become to where it was interfering with my ability to hold the reins. I think Dr. Musacchio was a little surprised that I put him on track for having the procedure, when the recovery was, and when I could get back on the horse. Immediately after the procedure, I did have feelings back in my hand. Each day it gets better and stronger.
And with the knee, she was back riding her horses within a couple months, and that's the most important thing and really satisfying for both the patient and myself that we could see a patient get better that quickly with such an easy process.
I feel great. Dr. Musacchio has been great. I go back for follow-up every couple of months, and each time it doesn't change. He is just as engaged in the treatment as what he was on the first time that I did see him.
For more information on any of the outstanding doctors you see on today's show, head to the website bestdocsnetwork.com. That is the place to go to find the doctor just right for you. Now it's time for our next best doctor. It is skin expert Clay Cockerell.
A lot of people don't really know what dermatopathology is. Basically what we do is if you go see a dermatologist and they look at your skin, and not always dermatologists, but mostly dermatologists, and they see something that they're worried about, or you've got a skin rash, they'll take a skin biopsy and they'll send it to someone like me to look at under the microscope to give them an answer. Basically, as a dermatopathologist, what you do is you go through training. You can either be a dermatologist trained first and then take another year or more, and then you're specialized as a dermatopathologist, or you can start off as a pathologist and then take a year of fellowship training and then take an examination, and then you also can be board certified as a dermatopathologist. There are a lot of skin diseases that people can get. I mean, if you open up a textbook of dermatology or dermatopathology, there are literally hundreds and hundreds of diseases that people can be afflicted with. And so when you go see your dermatologist, you know, they're trying to figure out what you have, and so one of the things they do is take a skin biopsy. Sometimes the answer is very easy under the microscope. You can tell right away, like for example, a lot of skin cancers are real easy to diagnose. Others may be more difficult to diagnose, especially some of the skin rashes that people get. A lot of them can look kind of alike under the microscope. So we'll often call a dermatologist and we'll discuss a case with them. Sometimes they'll actually send pictures. We'll look at the clinical photographs and correlate that with what we see under the microscope. Sometimes they'll even actually bring a patient to us to see, or they'll send them to my clinic, or we'll go to a conference where the patients are there, and then we'll kind of put everything together to come up with the right answer. Our goal is to try to get the best answer for the patient, because once we make a diagnosis, then they can start treating that disease appropriately and make them better. It is a rewarding field because we do make diagnoses and we do help people, and unfortunately I don't see a lot of patients, although I do still see patients at my clinic. But a lot of times we just get the slide under the microscope and then we try to figure out what's going on there. And most of the time we actually can help the patient and come up with an answer that improves the patient's lives. And that's quite rewarding when we're able to do that, and we get feedback from the dermatologist. Oh, you really helped my patient, you got the right answer, and I was able to treat them appropriately.
Dallas Maverick Jason Kidd is still playing basketball at the age of 40, and a key reason why is Texas sports hyperbaric. To find out more about Jason's story and other life-changing stories, log on to bestdocsnetwork.com.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
My migraine started March of 2009 from a faulty spinal tap, and right from there, my migraine never went away. I've gotten many treatments, a lot of medications, and I've seen countless doctors, and I just didn't get any relief. My mom and I went to Dr. Reed, and he felt like I was the perfect applicant for this stimulator.
I remember when Andrew came in for the permanent unit, we had to decide which side to put the battery on. It goes in the upper, outer, kind of rear gluteal region. Andrew wanted it on, I believe, the left side. Because he's a baseball player, he slides on his right side, so he wanted it on his left side. Which brings up an excellent point about the stimulators. There's no restrictions. Here's this very active young man, baseball player, sliding left and right, and no problem. He has done absolutely fine with the stimulators.
So I got my permanent stimulators implanted, and they put a little battery right at the hip, and it runs up your back. And I have 2 leads on my back, 2 leads on my temples, and 2 leads right here. And I'm able to control the frequency and the intensity of the stimulation with the remote. It's amazing what Dr. Reed has done, and I'm so appreciative of him.
He came back recently having lost a lot of weight. He lost so much weight, the little battery had gotten more superficial, and I needed to replace it a bit deeper in. But he was doing great with it. He's looking forward to going to college up at Texas Tech in a year. Like a lot of patients, he's done very, very well. I think it's safe to say that it's changed his life, certainly changed it for the better.
I don't care about having these batteries and these wires inside of me. I'm just so happy that my migraines have gone away. It's amazing what Dr. Reed has done.
For more information on any of the outstanding doctors you see on today's show, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com, the place to go to find the doctor just right for you.
And now we're going to check in with our next doctor. It's Mohs specialist, Dr. Patrick Walsh.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer. It has the highest cure rates of any technique of treating skin cancer and enables us to preserve as much normal tissue as possible while still removing all of the skin cancer. The technique is very much like the biopsy in that everything is done in the office. We just use a little local anesthetic, numb the area up, and remove the area that we can see. The way in which it differs from the biopsy is that we take the tissue that we excise and prepare it in our lab. We make our own slides, and I examine the slides under a microscope to determine if we've gotten all of the skin cancer. If we have, we stop there. If we haven't, we know precisely where any residual skin cancer is. We go back just to that area, remove a little bit more tissue, make some more slides, and keep repeating that process until we're sure we've gotten all of the cancer. If the skin cancer is very small and very superficial, the wound that results from the surgery that we do may be very similar to the wound they had after the biopsy. Very often it will heal satisfactorily on its own with good routine wound care. However, if the skin cancer has invaded more deeply or is wider than what it appears to be on initial exam, then we may recommend a repair of some sort. And they range all the way from simple side-to-side closure to a skin flap or a skin graft. And as with all cancer, early detection and treatment is the best way to cure skin cancer.
Depression is a very common and a very bad disease. It's different than sadness. Sadness is what happens when you go through bad times in life, and it just tends to come and go in all of our lives. Depression is an abnormality of the chemicals in the brain that brings on a lot of bad symptoms and often needs treatment with medications. The 2 main questions you should ask yourself to decide if you're depressed are these. Number 1, have I felt hopeless and sad for most of the time in the past 2 or 3 months? And number two, have I lost my interest in those things that I usually get a charge out of doing? For example, ball games with the kids, movies, certain meals, certain things on TV. If you've lost your joy in life, that's a sign of depression, and it needs to be treated. What can you do about depression if you have it? Well, you can do a lot. You can take medication. There's a lot of medications that work, most with few side effects. Exercise helps, getting adequate sleep, and counseling also helps. So there's a lot of ways to go from sad to glad.
We are here with one of the best doctors that specializes in the back and neck. He is a pain management specialist, a board-certified physician that treats problems with the back and neck. And some of your patients that come in, what are the most common symptoms?
Well, patients that come into my office often complain of neck pain that may or may not be associated with arm pain, numbness, or tingling, or shoulder pain, numbness, or tingling. They also might be complaining of thoracic or mid-back pain that may or not be associated with numbness, tingling, or pain radiating around to the ribs. Most commonly, they come in complaining of low back pain that may or may not be associated with leg pain, numbness, or tingling, or otherwise known as sciatica. What we find out is, upon evaluation of these patients, that this procedure addresses these conditions such as a herniated disc, a bulging disc, scar tissue that might be in the spine, from trauma, or even patients that have already had a surgery on their back and or a fusion of their back that still can be treated with this minimally invasive procedure.
Dr. Williams is one of the only specialists in the world that does a minimally invasive procedure that can detect and treat neck and back problems. Explain this procedure.
What I do is I make a very small 2 to 3 millimeter incision in a natural opening above the patient's tailbone without damaging any bone. It also has a laser, a state-of-the-art laser, and a high-definition camera that I can drive up to the patient's, into the patient's spinal canal and examine the patient's spine for herniated disc, bulging disc, scar tissue, inflammation, and then treat that patient's pain or a condition right there.
All right, Dr. Williams, so I have the procedure on my back or neck. What about the recovery time? How long?
Well, I'm glad you asked that, Jim. Since it's such a minimally invasive procedure and an outpatient procedure also, I usually can have a patient back at their desk job or office job the next week after they have the procedure.
All right, there he is, Dr. Jason Williams, the go-to doctor when it comes to back and neck problems. All right, thank you, doctor.
Thank you so much, Jim.
Hip replacement surgery and knee replacement surgery are two of the most commonly performed operations every year. In cases where patients develop an infection around an artificial hip or an artificial knee, a lot of times these cases have disastrous consequences.
I had 2 knee replacements in 2011, and both times they got infected. I talked to the internist and said, what happens if I don't do any more surgeries? Because I was miserably sick of having my leg sliced open and having to go through the rehab and the pain and everything. And the internist says, well, you'll die.
He had undergone a knee replacement for a worn out joint. He subsequently developed an infection of his artificial knee. When I went back to replace his knee, the defect was so large that I ended up having to reconstruct him with a design knee replacement that I typically will use for the cancer patients. Because he had already had a previous 2-stage exchange, he had a relatively large defect to reconstruct. So he required reconstruction of a relatively large segment of his femur bone. I had to remove approximately 4 inches of his femur bone because it was completely eaten away by the infection.
It's 100% better than it was 2 years ago. in all, he probably saved my leg. And he could have saved my life too.
The good news is that there's no sign of any infection coming back. He's still having some pain and some episodes of swelling, but he's better now than he had been for several years.
I'm able to do most everything I could do before, and when I pitched the pain pills, everything changed too. It makes you feel a whole lot better. Everybody says, well, bedside manner, it doesn't count. You've got to be a good surgeon. Well, he's a good surgeon. He's an excellent surgeon, and he's also a good communicator. So there's no surprises, when you wake up from the surgery. You know what you're up against, and you know what you had to look forward to.
All of the doctors here at the Best Docs Network are all about changing people's lives. Like our next doctor, it's PAMA physician and hand surgeon, Dr. Stephen Traum.
I was kind of up against the boards with the puck, and a player from the other team was coming in to body check me, and you just sort of brace yourself against the wall, and he literally just hit my elbow, and the boards were here, and it just popped. It didn't hurt right away, but I knew when he hit me, it was just an awkward feeling. Puck kind of went away from me, and as soon as I was out of the play, I pulled my glove off on the ice, and I looked down, and it was, at that time, my hand was sort of a couple inches over.
Imagine getting hit so hard that every ligament that holds your wrist and joint gets torn, and your wrist dislocates, pops completely out of joint. Those are very hard injuries to come back from, especially if you're a high-level athlete.
We have trainers and trainers' assistants and people like that have seen lots of injuries, and they were all just kind of like, oh boy. So I got the feeling that night it was sort of beyond sort of a physician that was at the game. And as an athlete, you're always thinking, well, is it serious enough that I can't play? And I found out it was serious enough that I wasn't going to be able to play for a while.
But he came in with an unstable wrist that wasn't staying in joint, and we had to try and address that in order to get him back to activity, basically get him to be able to bear weight at all on that wrist again. When you get hit that hard and you get that much ligament damage, all the ligaments kind of fold over on each other and crumple together, and they're not in a good position to heal. In order to get this injury to heal, you have to rearrange everything and bring the ligaments back out in line so they can heal and get solid again. And we were able to do that in a minimally invasive technique through a little telescope in the wrist joint. And what we did was we realigned all of his ligaments, cleaned out all of the torn and dead tissue that was in his joint, and then put his joint back in place, and then put a pin across it just through the skin in order to hold it in place to allow all the ligaments to heal.
Scarring-wise and stuff like that, just incredible. Couldn't be happier. You wouldn't know if I didn't show you the other one, I guess.
It was a successful procedure, it was a successful recovery, and we accomplished our goals of giving him pain freedom.
Dana, a mother of two, was diagnosed with breast cancer and credits Dr. Patrick Allen for saving her life. To find out more about Dana's story and other life-changing stories, log on to bestdocsnetwork.com.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
I had started very early in my 20s to get a lot of dental work, crowns. And then in my 30s, I realized it wasn't going to last forever. And this created some problems. Not only is it expensive, but it takes your time and it's uncomfortable.
Implant treatment has really been a great technology for patients whose teeth have reached a point where they can't be restored. Teeth that reach that point either have broken off, have decayed, or are just so broken down that we can't use them anymore in the reconstruction process. In those patients who have reached that point, we recommend removal of the teeth and reconstruction with dental implants. Sue had been plagued by a lifetime of dental problems, including decay and tooth loss. She had reached a point where we did not feel comfortable saving any of her natural teeth. So we decided we'd do a reconstruction for her with dental implants.
My friend Kelly is in the dental educational field, so he's very meticulous and precise. So you always go to the person that's best suited to the job. And in this case, it was a prosthodontist. Kelly said this was the only place to do it, and so this is where we did it. And he was right.
Sue was referred by a very close friend of hers who is a dentist here in Dallas. I was honored to get that referral because they had researched her needs and visited many offices before deciding to come here. What they found in their search was that a lot of the other practices were heavy on sales and very light on education. What they liked about my approach was that I simply gave them their options and was able to show them similar cases so they could make their own decision.
Dr. McFadden is very easy to talk to. He can take a joke, he's got a sense of humor, he's serious when he needs to be. He's very thorough, both in the procedures and also letting you know what's going to happen and how he's doing it.
Many times, patients' dental situations have deteriorated to the point where their whole mouth needs to be treated. Many people can't afford that, so we try to stage their treatment in a way that we have good stopping points along the way so they can regroup and plan for the future.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
This Friday, I'm going to have a gastric bypass. I chose the gastric bypass surgery because it has a higher percentage rate of reversing diabetes. And I would have loved to have done it by myself, but I need all the help that I can get. Because I'm looking at my lifespan and my quality of life. And if I don't put a stop to it now, then what does my life look like 20 years from now?
She's been overweight for a long time. She gained a lot of weight right after pregnancy and tried to lose that, wasn't real successful, and then she sort of became the caretaker for her mother. So she gained a lot of weight during that period of time.
I tried different diets and I tried some lifestyle changes without success. I mean, I'd get a little bit here, but then you'd gain it all back. And I became diabetic.
She's now trying to get back to being in better health. So she's been through the weight management program. She learned a lot about nutrition, and we've started her doing some exercise things. She's been to a psychologist and learned some more stuff about herself and how to deal with things, how to change habits, how to deal with stress with other things other than eating. It's really hard for people to lose weight on their own. It's really hard. And it's really kind of unfortunate because people look on the internet and they read blogs and things and they say, this guy, he lost 60 pounds in the first 2 months, and I think, oh my gosh, the guy's gonna die. But they think that that's wonderful because in today's society, what do we want? We want to be thin tomorrow, right? Oh, it's not gonna happen. It's not healthy to do it.
I'm looking forward to getting on a water slide, getting on the airplane without a seatbelt extender, getting on a roller coaster without thinking that the bar isn't coming down far enough and I'm gonna flip out. I am looking forward to climbing up the stairs without paying the fat girl tax. And this is gonna be great. This is gonna be great.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. Of course, Candace, the Best Docs Network is the place to go to find the doctor just for you. And for more information for any of our outstanding doctors, head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, we want to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.